So MS is an autoimmune condition that primarily affects people between the ages of 20 and 40. Women are disproportionately affected by MS at a ratio about 3 to 1 these days. In the 90s, even into the late 90s, women were routinely being told that they cannot have children if they've been diagnosed with MS. And thankfully that's changed considerably. So knowing that you can grow a family if you would like to in the setting of MS is a really important first step. Right at the time of considering a diagnosis, it's important to have a check-in with yourself and your provider about whether family planning is on the horizon soon, or maybe several years from now, or never. And that really allows the best shared decision-making to occur to pick a disease-modifying therapy that'll fit with your goals. So when we talk about risks in pregnancy, the main thing we're trying to avoid is new scars on the brain or spine that are going to cause some sort of limitation to a potential new mom. There is a little bit of a choreography that goes into making sure that we pick the right medications. And there are several reasons that certain medications may not be recommended. The most commonly asked one is toxicity to a developing baby. So what we often talk about are what are the effects to both mother when she's thinking about planning a pregnancy and to baby. There tends to be a lot of pressure in this time period, and having some of these conversations earlier with a good roadmap of what next steps are going to be helps relieve some of that pressure and that decision-making fatigue that can happen. One of the unique features of practicing as an MS specialist with this special interest in pregnancy at Duke is that Duke has one of the most robust interdisciplinary committees where we as a group of specialists get together and ensure that we are keeping up to date on the best practices of supporting care for people who are desiring pregnancies. This group is made up of liver specialists and kidney specialists and rheumatologists, myself, as well as the high-risk obstetricians, the obstetric groups. And to have this comfortable conversation amongst a group of colleagues so that we can all transfer information and learn from each other is a really powerful place to be. In the years that I've been providing the pregnancy counseling that I do for patients living with MS, I have been inspired by the patients who come back with their stories of not just a healthy pregnancy, but healthy children born to them. And truthfully, that is the large majority of patients that we guide through pregnancy. I get to often meet the babies, whether with a video visit postpartum or in the clinic. It's really rewarding, and it's something that continues to inspire me to show up and do what I do.